back with Tuesday Tips with Dr. Vidal here at Pure Plastic Surgery. This is our weekly check-in. We discuss different topics, plastic surgery, and answer your questions. Today, I brought my Christmas hat because we passed Thanksgiving. I gave time for Thanksgiving. I don't care, it's not December 1st yet, but I'm starting Christmas already. And we are discussing post-op supplies. This is a very common question. What do I need to bring? What is it that I'm gonna need? Depending on the surgery. I just want to bring a carry-on. Do I mail stuff? Do I bring it with me? How many fajas do I need? How many foams do I need? And all of that. So we'll go over what are the things that we usually need in the post-op course. And remember, this is for the first week. Then the recovery continues back at home, okay, if you're not from here, from Miami. So what things to bring are the essential things that you're going to need those first few days, okay? Number one, and the most important one you're going to need, especially if you're having liposuction or BBL procedure, is hydration. So plan to have enough hydration wherever you are staying. And when I say hydration, doesn't necessarily mean IV therapy. A lot of patients like to use IV therapy post-op, and it is an alternative, but it's not required and it's not needed as long as you're keeping a good PO or oral intake of fluids. And what is a good oral intake of fluid? At least 1 gallon of fluid a day, okay? Just put it into perspective. I'm removing 4 liters of fat from your body in 2 to 3 hours. What is that? I don't understand what is 4 liters of fat. Well, in our bodies, we have 5 liters of blood, okay? So 4 liters of fat is a lot in our body. And to remove that takes a toll. That removes a lot of the fluid that we have. Our bodies are going to go through a lot of hemodynamic changes. What does that mean? Our fluid status, our blood pressure, heart rate, trying to compensate, trying to improve the heart rate and the fluid, the system, right? And general anesthesia also plays a role in that. So the hydration is key for your post-op recovery. So what does it help? I think it helps a lot to have one of those containers that it's a gallon of fluid. You filled it up each day, and then you can tell how much fluid you're drinking. It's not, I think I got one glass in, 2 glasses in. No, if you have 1 gallon, you know that by the end of the day, you have to finish that. And it's very, very common that after the surgery, you're not gonna have an appetite. You are gonna feel full. So it's not that you're gonna feel thirsty. You're not gonna want to drink the gallon of fluid, but you need to so you can recover. And what are other adjuncts? So water is the most important component of this, but what are the other adjuncts? What are the other things that you should also add to that gallon of fluid a day? Pedialyte, Gatorade help a lot. Because it gives you electrolytes that you're gonna need, and you have lost with the surgery. And the other one is pineapple juice. Pineapple juice has sugar that's gonna help you feel better. And again, like I said, you're not gonna feel appetite. You're not gonna feel like eating. So you're not gonna be taking the amount of calories you normally take. So the sugar in the pineapple juice is gonna help you feel better. And also, pineapple has bromelain in it. Bromelain is a natural component that decreases inflammation. So it's going to help you with the swelling post-op, okay? So pineapple juice is a good thing to have. So you don't need to bring it with you in the plane, but you are coming day before. So you can plan to go to the supermarket and get some stuff. So that way you don't have to be traveling with all of this. There are a lot of things that come in packets, so in powder forms that are little packets that are easier to put in your luggage in your suitcase and bring with you instead of package of Gatorade and Pedialyte with you, okay? And then you just mix it with a bit of water. So plan ahead and have enough supplies for at least the 5 days post-op that you're going to be here, because this is going to be very, very important, and I don't want you to be running out of Gatorade in the middle of the night and not keeping up with your hydration, okay? So hydration, number one. Number two, the fajas. This is a very common question, that how many fajas do I need to buy? You're 2 weeks before the surgery and you want to be prepared, you want to bring everything with you. So the answer to that is don't buy any. Don't buy any fajas, okay? Why? Because you don't know the size that you're gonna be. I don't know the size that you're gonna be, okay? So the stage 1 and stage 2, what is the difference? So stage 1, it's a low compression garment. What does it mean is that for the first week or the first 7 to 10 days, we want the skin to heal a little bit. And the reason for that is because the cannula, the instrument that I use to remove the fat is like a little metal tube that's called a cannula, and that traumatizes the skin, okay? The surgery traumatizes the skin, and also the skin blood supply normally comes from the fat. So from the muscle travels towards the skin through the fat, and I'm thinning all of that, so there's an insult to the skin. The skin has already been like, what have you done to me? You took all the fat away and you're compressing me. So we need to give it a break. We need to give it time to breathe, to settle in, for the blood supply to improve, and to avoid necrosis or problems with blood supply to the skin, which will turn into what's called a lipoburn. A lipoburn is that. It's basically we're not getting good blood supply to the skin, and you can develop a wound in the area of the liposuction, okay? It can happen from the procedure itself or from a lot of compression too soon. Because the skin is still healing, we put a stage 2 or a high compression garment, we don't let the skin breathe, and we can cause a lipoburn, okay? So the stage 1 is the one that you're gonna wear initially, and that one, I'm gonna give it to you, okay? Here at Pure, we put it to you once I finish the liposuction. I'm gonna put you in a garment before you wake up. And why? Because at that time is when I choose what size I'm gonna put on you, okay? When I finish your procedure, I see what size you are, and I put one on you that is tailored to your size, that it's gonna be okay with the level of compression and also with the level of compression of the buttock and hips, so we don't compress that area too much because it's the fat grafted area in case of a BBL, okay? So the stage 1, I'm gonna give it to you, so you don't have to think about that. And the stage 2, you're not gonna use it until 7 to 10 days out. And by 7 to 10 days out, you're gonna be a different size than day 1, okay? So don't buy it initially, don't buy it before the surgery, and don't plan on buying it on day 1 or 2 post-op, because you're still gonna be very swollen. So you should wait until you're that week out, swelling starts to come down, your measurements are gonna change, and then you can buy the faja. You can buy it here, or there are a couple of stores that our patients usually use, and we can give you recommendations on where to get it, okay? But the fajas, you don't need to get beforehand, you'll get here, okay? Same thing with the bras, okay? If you're getting a breast procedure, a surgical bra, I'm gonna give that to you. Same concept, we still don't know what size you're gonna be, and I'm gonna know when I finish your procedure, so I'm gonna put you on a bra that fits you the day of the procedure. Then afterwards, once the swelling comes down, then you can buy another one, but don't buy it beforehand, because this, let's be honest, this garments and this bras are expensive. They're expensive, and I don't want you to be spending money that you don't need and and you can waste, okay? So that's with the fajas. The fajas, don't worry about it, I'll give it to you. Massages, this you should plan ahead, okay? Massages are extremely important. Why? Massages are good for the swelling, for the fluid buildup, for the scar formation, for irregularities, contour irregularities, okay? So massages, you're gonna start as soon as the next day, okay? It's not good to wait until you're here to coordinate and schedule a massage, because then you may turn into there's not availability, there's no one that can do, and it's so important that it's better to plan ahead. It doesn't have to be 6 months ahead, no, that's okay, but at least a week or 2 before your surgery, you should have your massages planned out. How many? So you start as soon as the next day, okay, for both liposuction or a mommy makeover tummy tuck. Both you start the next day. For the first 5 to 7 days while you're here in the initial post-op course, you should be getting 1 a day. So the safest thing to do is to schedule your massages 1 a day until your post-op appointment. That you'll need, okay? So that you can schedule. So you have your day of surgery, you get your clearance that everything is good, all your lab work was sent in and you were cleared, you can schedule your massages 1 a day until your follow-up. Where to get them, that is completely up to you, okay? We have a massage therapist here at Pure. She's amazing. So if you want to come in here and get it with her, you can. Talk to your coordinator and your coordinator can help you out to schedule that. But we are open Monday to Friday, okay? So if you are if you're having surgery and the weekend is going to be in between your surgery and your post-op day, then you'll have to schedule massages Saturday and Sunday elsewhere, okay? There are a lot of massage therapists that our patients usually use. Again, talk to your coordinator and we can give you recommendations. Also, a very good source is my Facebook group. My Facebook group with my patients. You are all great and I love that group because it has built a community, very supportive and very interactive. And a lot of my patients have had good, bad, excellent, not that great experiences with a lot of services here in Miami. And they can let you know, I use this service, I liked it because this and that, and then you can make your own decision, okay? So massages, plan ahead. How many? So this is the total number of massages I usually recommend. It depends, and we can talk about it specifically on your case on your pre-op day, okay? Because it depends on your skin laxity, prior surgeries, a lot of things. But usually for liposuction BBL, at least 20 in the entire post-op course, and the mommy makeover tummy tuck, at least 10 in the entire post-op course. Why I say in the entire post-op course? Because you're not going to be here near Pure in the entire post-op course, and you don't need to plan for the entire post-op course a month before, okay? Plan to have scheduled those 5 to 6, 7 massages that you're here in between surgery and post-op day, and then plan to get the rest near home. The Facebook group is also a great resource to try to find massage therapists where you live, because I've had patients from all over, and surprisingly, either my patients or in Dr. Earl's group, Dr. Earl's patients, you might find a patient that lives near you and can help you out with the massage therapist that they used where you live, okay? Clothing, this is a very common question. What should I wear? Something comfortable, okay? You're here in Miami, not on vacation, okay? You are not on vacation in Miami. So you can bring something pretty for the days before if you wanna come 2 or 3 days before the surgery and spend time in Wynwood, in Brickell, in the beach. I have no problem with that, but after the surgery, focus on your recovery, okay? I don't want you to be, walking out, getting dehydrated, or being exposed to the water or beach or other things that can complicate your post-op course, okay? So after your surgery, your focus is your recovery, and your clothing should relate to that. Is your recovery, okay? Wear something comfortable. What are the things that you shouldn't wear? Something tight in the waist, okay? That is gonna cause an indentation in your waist. So pants or underwear that is tight in the waist is a big no-no. Bras, if you're having a breast procedure, don't bring any bras. You're gonna have a surgical bra that you're gonna wear, and that's the one that you're gonna be wearing. Especially no underwire bras, okay? So that's gonna affect the incisions, that's gonna put too much pressure, okay? So the most comfortable one is a loose dress, or very like stretchy pants, sweatpants, and something that you can zip or button in the front. That way you don't have to be pulling over your head to pull a shirt or something tight, something that you can bring over and tighten or zip in the front. That's the easiest, okay? accessories. What other things that you should or consider bringing? Boards. So the boards, I don't like to use them in the first week, okay? So you don't have to bring them here. If you want to bring them to show them to me or the post-op team, the nurses can let you know, here, Sarah and Denny, they're great, and they can help you to see how you wear it, if it fits you well. So if you want to bring it in that sense for the post-op appointment, do it, but it's not a necessity. You don't have to bring it, okay? Because again, if you're gonna start using it, you're gonna start using it at least a week later, okay? Foams, we're gonna give them to you. If you want to bring an extra pair, you can, but we're gonna give them to you, so you don't have to stress about that. A BBL pillow, you should, okay? If you're getting a BBL, you should consider bringing a BBL pillow or buying it here in Miami before you leave, because you are gonna need it for the flight back home, okay? The flight back home, you're gonna have to sit for the departure and landing, so you're gonna need the BBL pillow for that. Okay, compression socks, we're gonna give them to you on the day of surgery, but if you wanna bring an extra pair to change them, you can, okay? Compression socks, you can buy them in Amazon, you can buy them in any store, and they're very important. You're gonna use them for any procedure for the first week, okay? So plan ahead with the compression socks. And the most important one, plan on your caretaker, okay? You are gonna be recovering, so you are gonna need help. And that doesn't mean that someone needs to you have to bring someone with you, but if you don't have anyone or you're traveling alone, you need to arrange for a caretaker that's gonna be with you for the entire week that you're here. Sometimes people arrange for a caretaker for the first 24 hours and then plan to stay alone. That is not safe. The reason why is because you're gonna have general anesthesia and you're gonna have a procedure that involves recovery for a couple of days. So you're not gonna be back to yourself in 24 hours. You're still gonna need help, okay? So plan accordingly and have someone with you for the recovery part, okay? I'll take some questions now.
The first one, how long do you have to wear compression socks for after surgery? The full 6 weeks after?
Okay, yeah, so compression socks, a minimum of 1 week, okay? Compression socks are extremely good for people with venous insufficiency. What does that mean? The veins in the legs don't work that good. How do you know if you have venous insufficiency? The common telltale signs are you have varicose veins, or you have it's called telangiectasias. It's like little strips of veins that you can see through your skin. Your legs get swollen. If that is your case, that you might need to wear them longer. But if you don't have venous insufficiency, you don't have any problems with leg swelling, then you should wear them for at least 1 week.
Okay, I like this one. Please talk a little bit more about the caretaker. It must be a nurse?
So no, it doesn't necessarily need to be a nurse. The majority of the caretakers are family members, someone that comes with you. Important thing is it's an adult that can take care of you, and taking care of you involves taking care of drains, seeing blood. So if the person that you're bringing as a caretaker faints or can't handle blood, that is not a good caretaker. So it doesn't have to be a nurse, but it has to be someone that can help you out and can help you with the drain, with moving dressings, getting you out of bed, walking, keeping you on top of your hydration, okay? A lot of people prefer to have nurses, at least for the first 24 to 48 hours. There are a lot of services, again, here in Miami that provide that. And if you want that, you can, but it's not a necessity.
Should Tony tell patients bring a pillow for the flight home to protect the stomach from the seatbelt?
You can, you don't have to, but if you feel that it's more comfortable, so you have something there to protect you, you can.
For arm lifts, does Pure provide any garments for that procedure along with a back lift? And what tape do you use if a patient is allergic to surgical tape?
Okay, so
two questions.
Yeah, very good questions. The first one, it depends on your quote, okay? So when you book, check your quote if it includes an arm garment or not, okay? So for an arm lift, at first, when you wake up from surgery, you're gonna have an elastic wrap, something that you wrap around. It's called an ACE bandage, okay? So that's the one that you're gonna use for the first week. There are some quotes that include your arm garment that looks like a sleeve that you're gonna put over, and that you're gonna start using it after your post-op appointment on day 5. So depends on your quote. If you have it in your quote, then we're gonna give it to you on your post-op appointment. If you don't have it, you can buy it here or you can buy it in another Fakas store, but you can start using it a week after, okay? And the second question was about, remind me again.
Okay. If do you use it for surgical tape?
Oh, the surgical tape, yes. So the surgical, if you're allergic to surgical tape, I usually use another gauze called Seroform and apply it with antibiotic ointment over the incisions so you don't have something adhesive that can exacerbate your allergy.
Okay, hi Dr. Vidal, it's Evelyn, the nurse from Montreal. Thursday will be my 5-week post-op and
awesome.
swelling are all gone. Do I still need to wait 6 weeks to see?
Yes, okay, so even though that majority of the swelling is gone, you're still healing, and the fat cells, we need to give them that extra week to settle in and make sure that they have good blood supply before we start putting pressure.
Do you recommend Arnica bruise gel for the first 7 days?
Yes, you can. The Arnica gel, as long as you're not putting it over the incisions, I'm okay with it.
Okay, and do you perform reverse tummy tucks?
So reverse tummy tucks is a procedure that it's not indicated for a lot of people. What do I mean by that? So a reverse tummy tuck is basically, if this is your abdomen, belly button, this is your hips down here, your breast, okay? It's for people that have just a little skin laxity over the belly button, but no skin laxity down here. This is tight. It's just a little bit here. And then you make an incision from here to here, here to here, and pull this skin up. Okay? So it's very, very rare that someone doesn't have any skin laxity down here and just up here, and we can pull it, and then the scar is on the, like similar to the breast lift scar that is hidden in the fold down here. So the answer to that is yes, but it depends if you're a candidate to it.
This is a long question.
Long question. Okay, I'm prepared.
If a patient is under menstrual cycle and needs to wear underwear, what should they do if it's not warranted to wear underwear?
Okay, so if you have to wear underwear, that's fine. A lot of people use a very loose diaper if you have a high flow, so you don't have to be changing it a lot. You can use underwear, but make sure it's a very loose underwear and it's not cutting or putting pressure on the skin.
How long do we wait to bend the waist after Lipo 360? I will have 2 weeks since my surgery.
Bend the waist, you can. There's not a contraindication for bending at the waist, not lifting. So you can't lift more than 10 pounds. But yeah, you can bend, no problem.
Yeah, okay. I have more here from the box. How many days we need to stay in Miami until we can go home from the mommy makeover procedure?
Yes, so plan for at least a week, okay? Why? Because you need to be here the day before the surgery. I see you that day, then it's day of surgery, and then I'm gonna see you on post-op day 5, okay? So post-op day 5 appointment, when you schedule your surgery, make sure that you see what day is post-op day 5. It's not that you leave on post-op day 5 at 4 in the morning. I need to see you on day 5, okay? And if post-op day 5 is on a weekend, then I'm gonna see you that following Monday, okay? So it all depends on your surgery date and when is that post-op day 5 appointment, and plan to leave evening at least, so you have plenty of time to come here. We do your follow-up appointment, make sure everything is good before you're going back home.
Okay, well, you talk about this, but how many massages for mommy makeover do we need to get?
Let's review. So for lipo BBL, at least 20 in the entire post-op course. For mommy makeover, tummy tuck, at least 10 in the entire post-op course. But again, it all depends on each patient. A lot of patients need more than this. Why? Because of skin laxity issues, because of prior liposuctions with scar tissue, seromas, etc.
Okay, another question about the massage. Do you recommend one per week post-op, one per day? How long for that?
Yeah, that's a good question. So for the first week post-op, so after surgery, you start the next day. And then for that first 7 to 10 days, one a day, okay? After that, usually you can start to win them off every other day, every 3 days, and so on and so forth.
Do we need fajas for a mommy makeover?
So yes, for the mommy makeover, you'll have 2 drains in the tummy and tummy tucks. You're gonna have 2 drains coming out on the corners of the incision. Because of the 2 drains, it's not really comfortable to wear a faja. So you're gonna have a binder. A binder, it's a wraparound with a Velcro that compresses the abdomen, okay? So you're gonna use that for the first few weeks while the drains are in. Once the drains are out, then you're gonna switch to a faja. Okay, so you don't have to buy a faja or bring a faja for a mommy makeover. We're gonna give you the binder, and that's what you're gonna use for the first few weeks. Once the drains are out and you're ready for the faja, then you can buy the faja. But you should wait again because you'll have to measure yourself, and the swelling it's gonna dramatically decrease by 2 to 3 weeks. And you're gonna be a different size completely from initial post-op to when your drains are out.
Okay. Do you perform neck lift?
Yes, I do. So neck lifts is a very, so to be a candidate for an isolated neck lift, it means that your face is not descent. So what do I mean by that? Usually with aging, what we first notice is the folds get deeper and we have jowls, which is basically the cheek fat kind of drops and we see a little bit of a jowl or excess skin down here in the angle of the mandible, okay? And then the neck. If you have that, then you're a candidate for a facelift. Why? Because if I just do a neck lift and improve the contour of your neck, the jowls and the folds and all of this is just gonna look unproportionate to your neck. You're gonna have a young neck with an old face. It's not gonna match, okay? So if that's the case, then you need a facelift. With a facelift, I do a neck lift as well. So those surgeries are combined in one. For younger patients that have the skin laxity here, but the cheek is not descent, you don't have jowls, you have a good definition, it's just the excess skin, then we can do a neck lift. A neck lift will involve small incision hidden here in the crease and an incision on the back of the ear to kind of pull the skin and then decrease the fat here and also repair. There's a little muscle. This muscle that when we move the neck is here, that's called the platysma. So the platysma, when we have excess fat in this area, tends to separate, similar to our muscles down here when they separate and we pull them together with the tummy tuck. It's similar with a neck lift. We kind of pull the muscle of the platysma together and that gives a better contour on the neck.
Is it safe to have 5 massages a week for the first 6 weeks?
5 massages a week for the first 6 weeks. Yeah, I mean, as long as you're not doing more than 1 a day, which is not necessary. If you want to continue doing daily massages more than the 7 to 10 days out, that's okay. There are a lot of patients that prefer that. And I think that at that time to make the decision on when to start to win them off or continue with daily massages, your massage therapist is going to be key to make that decision. Why? Because they have the experience and they've been treating you and they know if you still need or require daily massages or you're good to start to win them off.
Okay, I'm gonna do like a mix from a lot of questions.
Okay, I like it.
So many of the followers didn't know about the other procedures you perform. So why you don't say what are the things you can do, like blepharoplasty, face lift, labioplasty?
Yeah.
A glimpse of that.
Okay. So in the face, we can do the eyelids, which is upper eyelid, lower eyelid. On the upper eyelid, it's usually a combination of excess skin and excess fat. That's why it's like looks sometimes puffy. And through an incision, hit it in the crease of the eyelid. That incision heals very well. You can remove the excess skin and remove the excess fat and get a more youthful look of the eyes. On the lower eyelid, it depends, but you can also remove excess fat if it's very puffy, or excess skin if it's like puffy and droopy, okay? The incision, if it's just puffy, can be on the inside of the conjunctiva, so it can be hidden on the inside. But if you do have excess skin, then it just below the lash line in the lower eyelid, and we can remove the excess skin and remove the excess fat. I do facelift and neck lift that I talked a little bit about. I do rhinoplasties as well. Ears, otoplasty, which is setting back the ears for people that have prominent ears. I do gynecomastia in males. Gynecomastia can be either with liposuction only, a combination of liposuction and excising the breast tissue through the areola, or if you have excess skin, then excising the excess skin and the breast tissue itself through a scar that's going to be in the fold, similar to this type of scar that I talked about a little bit. I do arm lifts, I do thigh lifts, I do, what else, labioplasty. So labioplasty is when you have the labia minora, which is the skin tissue that's on the inside of the hair-bearing skin. So you have the labia majora, which is the one that you see on the outside, and on the inside of that, it's the labia minora. Some people have excess skin that protrudes outside of the labia majora and gets caught with the underwear. Sometimes, even if you want to wear like a tight bikini, it kind of shows. So if that's, gets you self-conscious in sexual intercourse because it's too long and too floppy, we can trim that tissue and get a better contour of the vagina. Okay, so all of those things, not only lipo and mommy makeovers, I do a lot of things too. Okay, so if you guys are interested in an evaluation, get into our website and fill in the virtual consultation form. You'll fill in some questions there, send some pictures, and I'll let you know if you're a candidate or what are my recommendations. And also I do fillers and Botox injectables here in the office, so that's also an option that you can combine with your surgery. So if you're coming over for a mommy makeover and you want to get also a refresh on the face and get a filler and Botox, we can do that too, okay? So thank you so much, you guys. I'll see you guys next week. No.
Tomorrow.
Oh, right. I'm like, why not? Yes, tomorrow I'm actually joining the boss, the GOAT, Dr. Alex Earl, in his Hump Day Live to do a combined Hump Day talk at 4:30. So log in tomorrow so we can both talk about a topic and answer your questions again. And again next week with Tuesday Tips, okay? See you guys.